Hello, everybody, and welcome. We're going to do a show today on Lyme's disease. Um, I've been asked to do it. I've been talking about it. I've been talking about some of the methodologies that I've utilized with Lyme's. You know, the standard treatment for Lyme's disease, once it's verified, is an antibiotic called doxycycline, and it's used, medicine likes to say for 30 days, 60 days. I've seen it used for upwards of a year to control this. Understanding that Lyme's is a extremely complex disease, extremely complex, with many controversial aspects, primarily seen in the skin after a bite, and it tends to really cause a big problem with joint pain, body aches, etc. The emotional ups and downs with Lyme's disease is also a big problem. So we're going to go through an article that was written by an Althea Northage, excuse me, who actively believes in a three-pronged approach for treating Lyme's that doesn't use an antibiotic. Now, yours truly is positive for Lyme's disease. Anyone who has had the number of tick bites that I've had, because I've been crazy enough to go out into fields in my backyard and cut down weeds and cut down grass and cut down areas in my backyard where deer would hang out. And these ticks tend to hang out on grass and weeds and higher than normal grasses. So I'm out there weed whacking down and cutting down these things, and they just latched onto me like water. In fact, one day my wife had to take 18 different ticks off me. Now, immediately upon knowing that I was bit and my wife saw the infamous bullseye on my back, I started treating myself aggressively. And I've done this with a lot of different patients at a lot of different times. Now, let me go back in time before we actually read this article, because this show may be a little longer than normal because I've got a lot of information to share. I'm going to go back to Dr. Russell Jaffe, who was one of my early instructors in Reston, Virginia, who bought a farm sort of in the rolling hills outside of Washington, D.C., where he was working for the National Institutes of Health, I believe. And this story goes back at least 15 years, maybe longer, where his son at that time, who I believe was 12 or 13 years old, was walking their dog out into the woods. And over the next couple days, started feeling great malaise and no energy. And Russ couldn't figure out what was going on with his son, so they took him in for testing and found out that he had Rocky Mountain spotted fever, which was rare, one of the earliest cases seen this side of the Mississippi. Now, if you go back 15 years ago, Rocky Mountain spotted fever was one of those that had a very dim outlook. We didn't have anything. It didn't respond to antibiotics. So Russ took his son aside. Russ, who was a huge believer in buffered forms of vitamin C, and started aggressively dosing his son. A couple months later, Russ got a call from, I believe, the University of Virginia, who said, we just wanted to get an update on your son. Is he still with us? Because typically, once diagnosed, it's somewhat terminal. If you could say something somewhat terminal. And Russ responded saying, my son's doing just fine now, thank you. So when I've had people that would call and say, look, I have one girl in particular I'm thinking of, she raises horses. And in the pastures, as she was riding, she has taken ticks off her body as well. And came down with all the symptoms of Lyme's disease. We ran all the blood work on her and came back positive. She says, I don't have time for this. I can't take an antibiotic. What do I do? So knowing what I had done with Dr. Russ Jaffe, I said, here's what we're going to do. we're going to take 1,000 milligram buffered vitamin C every hour while awake for 3 or 4 days. It's like, you want to talk about cumbersome? Say you're awake 18 hours a day. It's 18,000 milligrams of buffered vitamin C. And then repeat it again the next day, and the next day, and the next day, until the symptoms resolve. Now, to sit here and explain what vitamin C can do would take 4 or 5 days. But it upregulates your immune system to go into more of an attack mode rather than just a supportive mode. This article talks about liposomal vitamin C because this person who wrote this article probably is not aware that liposomal vitamin C, which means you take the ascorbic acid and basically surround it so that it gets higher blood levels. You use something to encapsulate it, sort of like an M&M, make it more bioavailable, but it's still ascorbic acid. I'm a big believer and a big proponent of buffered vitamin C. Now, she also talks in here about doing neurotransmitter support because the emotional side of Lymes is also dramatic. So when you have somebody diagnosed with Lymes, doing the blood test to verify the levels, verifying the extent of the disease, starting on the buffered vitamin C at a known dose, doing neurotransmitter support or testing to find out what the levels of serotonin, GABA, etc. are, and then other supportive herbs till you get through this. Now, as I said, my exposures to all those tick bites took place about 1.5 years ago. But I will still test positive all the time. But again, I did not have symptom 1. Let me read to you this. Lyme's disease is a complex disease that has many controversial aspects. Its transmission and methodology used for testing, whether or not there is a chronic aspect, and if so, how to treat it, are all subject to debate. Medicine just has having a hard time accepting that Lyme's is something real. Also, having a hard time accepting how common it really is. The official line presented by the Centers for Disease Control and Prevention, the infamous CDC, is that it is, quote, a tick-borne disease with no other route of transmission that is fully treatable by a short course of antibiotics, and that there is no such thing as chronic Lyme's disease, although there is a vague known condition called post-Lyme syndrome, end quote. Government does not want to accept the fact. The other end of the spectrum is represented by Lyme literate doctors, various Lyme supporting organizations, and alternative practitioners specializing in Lyme treatment. Coming again from Pittsburgh a number of years ago. I know this is a strange name, but there was a Dr. Swami, who was in the northern, near Lake Erie, that was a Lyme specialist, one of the few. So he falls into this category of one of these alternative practitioners. Their positions vary, the extreme end being that the Lyme's disease is epidemic, also impossible to treat without serious long-term antibiotic therapy in very high doses, and that can be passed through breast milk, sexual contact, and also by fleas, mites, mosquitoes, and blood body fluid contact. I don't buy that. Treatments include herbal regimens, heat therapies, energetic treatments with devices such as a Rife machine, and of course, antibiotic therapies in various combinations, and usually long duration, frequently in the form of intravenous treatments. Lyme's disease, let's get this straight, is caused by a spirochete, something that burrows in. It's like a screw. There are 3 recognized genotypes. Borrelia burgdorferi, which occurs in North America. We will call that BB. Borrelia garnila and Borrelia afzelia, later 2 occurring in both Europe and Asia. So BB occurs there as well. The primary vector of infection is a deer tick, and it goes through the names of those in its nymph stages, although the adult is capable of passing the infection. The most likely time of the year is spring and summer. While research exists documenting the presence of BB, remember what I said, Borrelia, in mosquitoes, fleas, and mites. Reported cases of individuals contacting the disease from them does not appear in the literature. Insects other than ticks are unlikely to be good transmitters. When the tick bites, there's a time period of up to 36 hours during which the infection is unlikely. First, the tick injects a minute amount of blood thinners into the site in order to facilitate blood flow. This is some high-tech stuff, folks, from a tick. It then secretes another substance over an extended period of time, building a gummy seal between its mouth, and the victim. Only after it has completed the process does it begins feeding. During this preparatory period, the BB spirochete is doing work on its own, coming out of latency and secreting its own chemicals and binding with a thick protein in order to make an end run around the endothelial cells of the tick's gut in order to migrate to the salivary glands and into its new host. Sort of like a horror movie. The CDC has recently recognized that there may be a problem with blood transfusions and has asked that active Lyme's patients refrain from giving blood, as latent Lyme forms are capable of later becoming virulent under the right conditions. The best prevention against Lymes is to protect the skin via clothing and repellents and to check the skin thoroughly after coming in from the outdoors. Ticks don't embed themselves immediately, so immediate tick checks and removal will prevent infections. Even though you find one on your skin, if you get it off quick enough, you won't run into a major problem. Tick nymphs are so tiny that they're easy to miss when performing visual inspections. If a tick is located, it should be removed by gently pulling it loose with tweezers. Squeezing or tearing at it may cause the tick to regurgitate the contents of its stomach into the host, thus passing the infection. Can often use essential oils near the site, which will cause the tick to release its hold. An effective additional technique of removal is to wrap wide tape, adhesive side facing out, around the hands and pat the entire surface of the skin and have it pulled out that way. The symptoms of Lyme's disease typically appear from 3 days to 3 weeks after infection. They can resemble the flu and be so mild to be undetectable. One of the first signs of infection is often the characteristic erythema migrans or bullseye rash. This rash doesn't always occur. Estimates of how many infected individuals will have the rash vary between 30 and 70%. The initial stage of the infection may present symptoms as fatigue, chills, fever, headaches, muscle and joint pain, swollen lymph nodes. The second stage may last several months, and symptoms include multiple skin rashes, central and peripheral nervous system disorders, heart palpitations, arthritis, neuralgia, extreme fatigue, general weakness. Other symptoms could be pericarditis or other serious heart problems, optic ataxia, psychosis, depression, hallucinations, memory loss, and the list goes on. Third stage may last for months or years with recurring neurological problems, organ failures, and arthritis, sometimes called post-Lyme syndrome. There is no well-accepted definition of post-Lyme disease. It has been contributed to confusion and controversy and a lack of firm data on its incidence. There is no convincing biological evidence for the existing of symptomatic chronic BB infections among patients after the receipt of recommended treatments for Lyme's. In other words, the CDC says, a couple weeks of doxycycline, you're done. The proposed treatments are short-term antibiotic therapies, usually no more than 3 weeks of doxycycline. For those with more serious complications such as Lyme's, meningitis, and it goes through central nervous system involvement or heart symptoms, can use intravenous forms. And again, medicine has recognized this. Patients with lesser symptoms who relapse can be treated with a second course of 4 weeks of antibiotics. Late-stage Lyme patients with neurological symptoms are advised to do 2 to 4 weeks of intravenous antibiotic therapy. Beyond these recommendations, again, the CDC says stay away from all these other crazy people that want to do everything else. Because of a lack of biological plausibility, lack of efficacy, absence of supported data, or the potential of harm to the patient, the following are not recommended for treatment of patients with any manifestations of Lyme's. Cephalosporins, fluoroquinolones, these are all classes of antibiotics, folks. And I'm not going to go through the whole list. But again, none of them become very effective. As a clinician who has seen Lyme's patients who have tried, accepted therapies, and then went on to have huge problems ranging from kidney failure, heart attacks, temporary paralysis, Parkinson's syndromes, inflamed joints, one's inclined to be dismissive of the CDC. However, their caution is not entirely unjustified. When one studies the effectiveness of the BB spirochete at avoiding antibiotic and immune system activity in ways the risks of long-term intravenous antibiotic therapies employed a rotating cocktail of drugs that must be used in sufficient quantities to get across the blood-brain barrier, which is why it sometimes takes longer than just a month. The protocol that I like to use for Lyme's disease has undergone many stages, in part driven by a 4-year exhaustive battle with a severe form of neurologically active Lyme's. This wasn't me. I went through probably a 6-month period, no major problems, and now I'm kicked it. In one notable case, this lady says, the patient arrived in a wheelchair with massive pain and Parkinson's-like syndrome, widespread cognitive issue, and muscular weakness. She was receiving daily IV drugs and was severely debilitated. Within 6 weeks on a protocol, she was off the drugs, out of the wheelchair, and back on her feet. The protocol that we're about to describe, this is not mine, this is what was done here, published in this journal, adheres to the Hippocratic maxim of do no harm and is based on clinical experiences upon the scientific information on Lyme's disease. In addition to being effective, the protocol minimizes, if not completely eliminates, the dreaded Herxheimer reaction caused by the inflammatory action of the endotoxins emitted when the spirochete dies. Treatment is composed of 4 elements, each of which addresses different aspects of the disease. They are the bacteriostatic effects of high-dose vitamin C, dietary support, neurotransmitter support, and botanical medicine. Now, let me first give you the phone number here at the office. If you are seeing this video and you know somebody that's dealing with Lyme's, have them give us a call. We don't propose to have all the answers, but we know on this kind of a protocol how effective it can be. Let me just say this: bactericidal, bacteriostatic. Bactericidal, antibiotics that come in and kill, cytal. Bacteriostatic, interfere with the propagation of the organism so that it dies a slow death and leaves more effectively. That's what vitamin C does. Studies on the replication cycle of the BB indicate that in order to be truly effective in eradicating the spirochetes, it's necessary to do high-dose antibiotic therapy sufficient to cross the blood-brain barrier for no less than 18 months for full eradication. Nobody in the medical field will do that. That was published by Dr. Bradford in 2006. In addition to the length of the treatment with its attendant risks of blood infections via the peripherally inserted central catheter line, the antibiotics need to be given in alternating combinations in order to evade the genetic capabilities, etc. Vitamin C therapy has been shown to be effective against a wide range of illnesses, including polio, other tick-borne diseases such as Rocky Mountain spotted fever, Dr. Russ Jaffe, and in some cases, cancer. Numerous studies extend as to its effectiveness as an antibiotic, and also more interestingly, in light of the inflammatory effects of Lyme's endotoxin on its ability to bind with the endotoxins, etc. Dr. Lyda Mattman, a Nobel Prize-winning scientist who developed and devoted her life to the study of the cell wall deficient pathogens, was able to demonstrate that Lyme's can readily shift back and forth between forms based on whether circumstances were favorable for the thriving of the pathogen. Studies of BB has shown that it's very hard to kill because it's able to assume a variety of forms. It can appear in the motile spirochete form, a characteristic spiral-shaped bacteria with a complex cell wall structure studded with foreign proteins that allow it to digest the walls of healthy cells. Another form is called the bleb form, B-L-E-B. Bleb results when a spirochete breaks off. Small pieces of its DNA float in the bloodstream and bind with immune cells. There's also the cystic form, when BB invades other forms and hides within them. The most alarming of all is its cell wall deficient form, CWD, a form which both the immune system and most antibiotics are unable to combat because their mechanism of action is to target the foreign proteins on the cell walls, which BB does not have in this form. In order to successfully combat Lymes, one needs to employ different strategies for the different stages. During acute flares, high-dose intravenous vitamin C administered under medical supervision allows the blood levels to attain a high saturation point, which can effectively kill the spirochete and possibly the cystic forms. During maintenance periods, most doses can be done orally with buffered vitamin C forms. It's an effective tool against encysted forms. It's been demonstrated to penetrate rapidly through the cell walls, even into organelles within the cells. Many protocols suggest taking vitamin C, but in acute stages, it's unlikely that oral doses will attain high enough saturation levels, which is why I went, when I had administered that, to 1 gram every hour till we reached saturation. Any family doctor can administer intravenous vitamin C, but there's not many that will do that. So again, exploring somebody that's willing to do that is a huge thing. Diet. Other known aspects of the Lyme spirochete and its replication cycle is that it lacks appropriate nutrients. It passes into latency only to reemerge when food appears. What is interesting is what the pathogen uses as fuel. Studies have shown that it has 2 main food sources, sugars, and unfortunately, N-acetylglucosamine. This means that glucosamine sulfate, a substance frequently used to treat joint issues, is contraindicated in the treatment of Lyme's. More importantly, one needs to deprive the pathogen of its sugar source. This forms the basis for the dietary aspect of the protocol. An effective way of driving the disease into latency is for the patients to follow a ketogenic diet, a diet in which ketones become the cellular fuel rather than glucose. And again, when we get to our prep called Net Zero Keto, it's going to become a foundation for the treatment of Lyme's. When the patient feels they're in remission, they can begin to experiment with raising their carbohydrate load, but that should remain in ketosis or at least maintain a low glycemic index diet. This may mean anywhere from 40 to 100 grams of carbohydrates a day, 40 to 100, depending on the person. A very simple way to stay in ketosis is simply follow the directives of the first 2 weeks of the Atkins diet, which offers many helpful tools, such as books that list the protein, fat, and carbohydrate levels of foods. Now, next is neurotransmitter support, as he mentioned, or she mentioned early on. The third aspect of treating Lyme's is to remove and or limit the severe neurological effects caused by acetylcholine depletion in the synaptic spaces. Acetylcholine, one of the necessary nutrients for the brain to communicate. This is one of the aspects of Alzheimer's. When that disappears from the brain, it's the basis of the drugs that are used, which are acetylcholinesterase inhibitors. BB toxins interfere with the enzyme, causing an interruption of acetylcholine across the synaptic space carrying nerve impulses. This depletion is which causes the paralysis, weakness, and neuropathies demonstrated in many Lyme's cases. Greater the depletion, the more paralysis there'll be, but even in milder forms, most times. So, providing the building blocks for acetylcholine can greatly reduce or eliminate these issues. In addition, several other supplements such as fish oil and vitamin D ought to be added, as well as a good multivitamin. Supplement regimen. Some that have major supportive help. Resveratrol, 250 milligrams once a day. Japanese knotwood, often used to treat Lyme's and other similar ailments. Traditional Chinese medicine, it's known as an anti-inflammatory and an antiviral. Lysine, 1,000 milligrams twice a day. This is one of the precursors for acetylcholine, but it's also important as an antiherpetic and antiviral. Our twice daily multiple, as directed on the label, 2 capsules once or twice a day. The importance of the multivitamin cannot be overstated. Mineral levels need to be high enough to support detoxification pathways, and many other essential vitamins may be lacking due to digestive disturbances caused by the illness. A vitamin B complex, 1 pill 3 times a day, vital for healthy nerve function. Vitamin D3, 5,000 IUs once a day. Fish oil, like our Pro Omega, again, twice a day. Probiotic, as directed on the label. We can also use coenzyme Q10, 200 milligrams once a day, a vital component of compounds depleted by Lymes. And then we can also use other preps like ATP fuel, adenosine triphosphate fuel. So there's a lot of other herbal treatments. I'm not going to get into all of those right now. Cordyceps sinensis, maitake, sameto and cat's claw, Japanese knotwood, astragalus, ashwagandha, ginseng. I mean, you could go down the whole gamut of different things that could be used. Boswellia, curcumin. They're all out there. I like to use an extremely targeted approach. When all is said and done, treating chronic Lyme's disease is complicated and often frustrating experience. While many people become symptom-free after a 4-week course of oral antibiotics, estimates are generally in the range of 70 to 80%. One cannot know whether it has been truly eradicated or if it has simply gone dormant, only to explode later in some form which may go unrecognized as Lyme's. Each case is unique, complex, and needs to be treated by tailoring the protocol to the individual. I now have enough cases of recovered patients to feel much more hopeful that after 2 years of the supplementation of vitamin C regimens can be dropped for most patients. I do recommend that they remain on a supportive herbal therapy and they maintain a low glycemic index diet of whole foods. While I did not recommend refusing the initial course of antibiotics in the treatment of Lyme's, it might be wise to consider keeping even asymptomatic individuals on vitamin C and botanical remedies for up to 18 months. This would do no harm, but might further lower problems down the road. In the treatment of chronic Lyme's, the long-term programs with their alternating combination of antibiotics and chemotherapy-like doses seems unnecessarily dangerous, especially given their dubious track record of producing cures. The importance of studying and understanding long-term botanical and lifestyle protocols and treatment seems to be a very important task given the rapid increase and the levels of Lyme's being seen. Lyme's could be a poster child for the problems that occur when a devastating disease becomes a political backdrop for competing theories of medical treatment. In this battle, where innovative protocols are held hostage by the polarized climate of medicine in America today, the real loser turns out to be the patient. Botanical medicine, with its history of treating the whole person with nutritive therapies and its rich tradition of treating pathogenic infectious disease in the long history of humans on this planet, needs to be an important part of the complex and evolving fight against infectious disease. Simply relying on therapies that purport to destroy pathogens without regard to their effects on overall health of the patient is neither an acceptable nor a sustainable solution. We need to develop therapies that are supportive, flexible, and that honor the body. Want a copy of that? Just give me a call. It's our new protocol. That's what we're going to stand by. Probably introduce neurotransmitter testing to make sure that we have that under wraps as well. Now, if you know somebody that's suffering from Lyme's or you suspect it, because I have a number of families now dealing with a new problem called PANDAS or PANS, where the body goes through a inflammation period in the brain, which is linked to a staph or strep infection, secondary typically to Lyme's. It's a great thought. And again, the concept of using buffered forms of vitamin C over an extended period of time comes in a powdered form or a tablet form. And remember, folks, the buffered forms of vitamin C are only 9% of the vitamin C that is out there. Using ascorbic acid will not work in this situation. You want more information on buffered forms of vitamin C, typically coming as a raw material source from Ireland. We have our own brand of that and also a potted form by Claire Labs. Give us a call at 678-228-8900. You want more information? You go to our website at thenutritionshop.net. Tomorrow on the show, we're going to do an expose of why I say Made in America is crucial. New expose on the adulteration of herbal products in this country. They're coming in from overseas. Lyme's is huge in this area of Atlanta. Lyme's was even huger in Western Pennsylvania. It's not going away, folks. And you're now seeing it being latent and hanging on for many, many days. One of the reasons I take buffered vitamin C each and every day. Once again, the number to reach me here at the office, 678-228-8900. You can call anytime, 24 hours a day. Leave us a message. We'll be getting back to you as soon as we can, or communicate to us through our website at the Nutrition Shop, SHOPPE.net. All right, folks, God bless you. See you back here tomorrow. Hopefully you can go back and listen to this again. A lot of information on Lymes. Talk to you soon.